difference with this specific approach in terms of precaution and post-operative rehab scheme? Well, absolutely there is. As I said, with this approach, due to the situation, we find perfect cut placement, better exposure, no muscle detachment. It did not happen to me with this specific approach. Therefore, I allow my patients to do literally everything. So they can bend their hip over 90 degrees. They can sleep on their side if they want. They don't need to have a resting pillow in between their knees to stabilize everything. They don't have to lay on their back or are restricted to that position with some brace holding it there. So literally, I have never experienced any of these problems. So therefore, yes, you could do way more. Whereas most of the patients, they are just comfy with not doing too much because they were told over times that this is quite a dangerous thing and this might happen. So, but anyhow, if you have a wider safety margin as a patient and you don't have to fear this problem too much, obviously this is a great relief of stress. The normal expectance is that you stand up at the day of surgery, you walk a couple of steps, possibly without crutches, if you're able to. And then obviously this is a stepwise thing and it goes on and on. Sometimes due to the analgesia that we put inside during the surgery, the first day is a little bit better than the second. So at the second day, you go through this little valley after the surgery, but the third day already is for your walking at your own convenience. So if you can do that, but we recommend our patients to use crutches for 2 till 3 weeks, whatever suits you. And if that works for you, you can get rid of the crutches. So, and well, obviously there is a wide variety of cases that we see. Some patients come in with a very bad gait pattern and an already compromised situation before. It's hard to bring these up in no time, but if there are patients that basically are not depending on canes or crutches prior to the intervention, most of them, as I said, 80% can walk at day 1 without any crutches.